We all know, don't we, that the healthcare business is misnamed. We all know, but we take for granted that most healthcare spending would be better described as sick care. For decades, we've known that prevention is cheaper than cure and that early cures are far better than later remedies. But despite this, it's still true that the treatment of conditions that are well advanced consumes far more of our spending than prevention or treating illnesses before they show symptoms. But my reading of our market is that this is really beginning to change and that managing health with foresight is beginning to catch up with curing illness with hindsight. As ever, let me try to get to a practical conclusion via a diversion into the management science. When I'm asked by pharma and medtech companies to help them predict and prepare for the future, the biggest issue I face is that they and I are often looking at the world through very different perspectives. In many biomedical companies, the executives I work with have a very strong science and medical training. That's where I started my career too, as a lab rat working in R&D. But I've been lucky enough to also have a good social science training. I was sitting at the feet of some of the world's best management scientists. For all of us, our intellectual backgrounds tend to shape the way that we look at the world. For example, I often find that science-trained executives have a strong reductionist paradigm. Their habit is to reduce complex phenomena down to a few component parts and to look for direct causal linkages between those parts. For example, I'm currently acting as a mentor to a senior executive in market access. She's a very bright woman with a clinical science background and a health economics training. She explained to me recently how demographics is causing an epidemiological shift, which is increasing demands on healthcare budgets, which is leading to constraints on market access. It's a very linear, reductionist framing of the issue. Now, as a mentor, my job in this situation is not to tell her what to do, but to help her think better. But to do so, I need to weigh my words carefully. Because it's not that her reductionist view of the world is wrong, it's just that it's incomplete and overly simplified. Not only does her worldview not include everything that matters, it also neglects the complex interactions between the component parts of the health economy. When I listen to this bright, educated and eloquent woman, I don't think she's wrong, but Shakespeare's famous words about there being more things in heaven and earth than are dreamt of in your philosophy come to mind. To help her, we discussed my own paradigmatic journey from a reductionist research chemist, with what philosophers call a logical positivist epistemology, to be a pragmatist in the special epistemological sense of that word. That journey was an important one for me. It allowed me to look at the world through a lens of complexity theory and Darwinian evolution. Now, I won't go into the weeds here, but if you want to know more about epistemology, then give me a call and we can set up a virtual coffee. But what's all this philosophical waffle got to do with sick care transforming into something that deserves the name healthcare? Well, whatever your perspective, we all agree that preventative and early treatment measures would be good for us all, and that it's frustrating and perplexing that they seem to be so slow in becoming the new norm. But if you're a reductionist, it's very easy to find simple explanations for that slowness. Perhaps it's the reluctance of peers to reimburse. Perhaps it's the technology isn't right yet. Perhaps the market isn't ready. And these are all good, straightforward, reductionist answers that executives give me every day. They're all correct too, but they are all incomplete and overly simplistic. From an evolutionary point of view, the future hasn't changed yet. The future hasn't emerged yet, because peers, technology, patients, and many other factors haven't yet combined to create the selection pressures that favour the emergence of prevention and prediction over late diagnosis and cure. But the good news is that it doesn't take much looking to see that future emerging. I've enjoyed reading recently about Wiring's new patient use device that combines ECG, blood pressure, and a digital stethoscope with surprising accuracy. Even more interesting was reading recent surveys that physicians are starting to take this home-based assessment seriously. Direct-to-consumer blood testing is gradually emerging too, and so are self-administered diagnostics for things like STIs, infertility and other conditions. We can already see that continuous glucose monitoring has transformed diabetes care in recent years, and I guess it's only a matter of time before we see patient versions of Abbott's handheld iStat device. In the hospital, innovations like Philips Ingenia are enabling early cancer detection by integrating MRI and CT scans. In the same field, biomarker technologies like Illumina's TrueSight are becoming increasingly important. And in structural heart disease, long and undertreated condition, Edwards Ignite is using AI to interpret ECGs for better, earlier detection. I could go on, but you get the general idea. Prediction and prevention are emerging from the system, just like your ancestors emerged from the African savannah, because the conditions now select for that emergence. So if I'm right and we are finally moving closer to predictive and preventive healthcare, then how do we accelerate that trend? I'd argue that reductionist solutions, such as trying to convince payers to reimburse, are incomplete answers. We need to understand the combination of conditions, economic, sociological, technological and others, that have to come together to make this happen. We know from Google search data there is a large body of society that is ready and waiting to become obsessed with their own health data. But to release this potential, we'll need to work on patient attitudes, just as Abbott did in leading diabetes patients to be more proactive in managing their glucose levels. At the same time, health technology assessors will need to be encouraged to evaluate how systems promote health, not, as they generally do now, assess how individual products manage illness. And we'll need to push the trend already revealed by the surveys of reassuring professionals that home data is not synonymous with bad data. Most of all though, we in the industry will need to start shifting the way we think, from reductionist to Darwinian. The world, our market, is not a machine where we can pull a lever to make the future happen. It's more like a garden where we have to nudge, coax and persuade healthcare to emerge from sick care.